Nathaniel Kenneth Westhoff. He is now 7 hours old and doing very well. He weighs 2 pounds, 6 ounces and is 14.5 inches long. He came into the world at 8:13 this morning. His parents are Peggy and Ken Westhoff, and they're also doing very well. He is having a little difficulty breathing, as you notice by his chest caving in. He's having difficulty. I don't know if you can hear him breathe or not. That's the noise that he's also having difficulty breathing. What I just lifted was what we call hood oxygen. That's what's delivering the amount of oxygen he's getting. At this point, what he's getting is about 40%. What you and I breathe is 21%. So he is in some oxygen, but not an awful lot either. He is, at this time, trying to decide whether he wants to be on the respirator or not. The grunting, what we call the noise that he's breathing, is grunting. And that means that he's having difficulty breathing. But according to his blood gases and his monitor, he is doing okay with the amount of breathing that he is doing. His oxygen level is about 67, between 60 and 70 in his blood, and that's very adequate for him. If he should decide the grunting should become faster, more difficult for him, he will all of a sudden just decide to quit breathing, and that's mostly just from being tired out. And if he does that, he will get the ventilator, the respirator, which is this yellow box right here, and that will help him breathe. He will like that when he gets it, because he will not have to breathe either very much or at all once we do that to him. However, we do not like to do that to him if we don't have to, because he will like that ventilator and decide not to breathe on it at all on his own, and so then it's a matter of weaning him off that. And that can take anywhere from 3 to 7 days to wean him off of that. We wean him off slowly and decrease his rate according to how much he breathes on his own. And so that's why we're giving him this trial at this period of time, so we do not have to put the ventilator on him. If we do that, we have to put a tube in his mouth and tape that securely, and he cannot cry. His activity will be limited. And so that's also why we have not chosen to do that to him yet if we don't have to. You will notice he moves a fair amount, which is good. He has opened his eyes. The white bands around his arm and legs are what we call electrodes. He is on a heart monitor, and he will be on that as long as he's with us here in the nursery. They are very similar to the ones that you see on adult patients with them on their chest, and he will go to that size eventually too when he gets a little bit bigger. The other probe that you see on his abdomen is what we call a transcutaneous monitor, and that monitors the amount of oxygen level in his blood. He also has a tape band around his foot, and that is what we call an O2 saturation machine, and that also monitors the amount of oxygen in the blood. Both of these machines he will have on him as long as he is in oxygen. Once he is out of the oxygen, we will keep them on for about 24 hours, and then they can come off. We're going to overview the ICN unit. This is the desk. X-ray view board is way in the back of the room, along with warming lights, other type of lights. Notice all the equipment. Now we're back to Nathaniel's bed. This is the IV pump that he will be getting his nutrition from an IV. You cannot probably see it real well, but he does have a line into his umbilicus. And this delivers the IV fluid that he will be getting in place of his oral feedings. These are his monitors. The bottom one is the heart monitor, respiration, and blood pressure. He will be on a heart monitor as long as he's with us. The second machine is the O2 saturation machine. And I don't think you can see those numbers, but he is reading in the 90s, and that's where we want him. The top machine is the transcutaneous monitor, and that is reading in the 30s and the 60s, and that's also where we want it. This is kind of for Nathaniel's name tag on his bed. For his footprints. Blue tube you see going into his hood is the oxygen that is delivered. It is humidified. This is Nathan now at 11 hours of age. Still is not on the ventilator. Seems to be breathing a little bit easier and not grunting as much as when he first came in. He still grunts some, but as you notice, not near as much as before. We have taken him out of the oxygen hood, and she is now holding the oxygen to his face. He does grunt when you touch him. When he moves, he does grunt more, but ordinarily he grunts intermittently now. Go ahead and move his head and see if he'll open his eyes or cry.
Just move it what you mean.
Up or down, yeah. We're trying to get him to open his eyes. See if he'll open them for us. Not real cooperative. Tired. I'm also still tired from trying to breathe. He's now crying. At this point now, he does not like to be touched that much. He would rather be left alone. Nathan, back in his hood oxygen again. As you can hear, he is grunting now a little bit more. And that's just due to moving him, making him mad.